Hi, I'm Mallika Shah, a senior psychologist at Amaha, Mumbai. I'm here today to answer some questions regarding what resources can be used to build on your resilience as you deal with certain mental health disorders. So, the first question that we have: I've been diagnosed with ADHD and I struggle to stay organized and focused at work. Are there any specific tools or strategies that can help me manage this better? ADHD is attention deficit hyperactivity disorder, which is a neurodevelopmental disorder often and most commonly seen in children, but also affecting adults, which specifically shows up with certain symptoms like having a difficulty in focusing on a task at hand. One of the things that can really help in staying focused can be something that is as simple as asking someone to be with you when doing a task. This tool is often called as body doubling. What does this even mean? An easy way to somewhere stay quite gently accountable to another individual is helpful in building enough motivation for you to stay focused on the task that you are up to. This doesn't have to mean that the other person's consistently pestering you or following up with you about the task that you're doing. It simply could be that while you are doing a task, someone else whom also you have had this conversation with, to ask them to be a body double for you and for them to also sit quietly with you so that they're not distracting you necessarily from the task that you're doing. It may be a small accountability factor for you to stay on track with your task. Another technique that may really help is what we call as Pomodoro. Pomodoro is essentially breaking the time that you want to give to a certain task into split sections, where it may be as simple as, let's say you want to start giving something 30 minutes of your time. Set an alarm for 25 minutes and have that be the time that you do simply one task at a time, and let that be the time that after the alarm rings for 25 minutes, there's 5 minutes for you to take a break from the same, to have that time to recuperate, do whatever tasks that may be otherwise on your mind. A lot of times, what might happen, specifically with ADHD, is that while you are doing one task, another task or another activity that you wanted to take up, whether it was urgent or not, comes up in your mind. These 5 minutes could also be taken to maintain a list that you can go on and keep following it up with, to where you just write the next task down that you can take up after this task is completed. Now, the last tip that I would say, which can help with building a little better organization for yourself, is to find out what motivates you about taking on certain tasks. We might want to take on some task that feels extremely important for us to do, but to get to actually doing it in action is a little bit away from it. And what that gap essentially means is that sometimes we might find ourselves being bored of it, not finding as challenging, or find it too challenging. Sometimes this tendency to want to do it perfectly can be a large part of what creates this gap into actually putting it into action. Identifying what causes this gap for yourself and what would make it easier for yourself to do the task is sometimes the best way to almost bridge this gap with those little planks that can act as bridging bricks for this bridge for you to go ahead and actually do it. I hope these help you stay a little more organized at your workplace. My friend has schizophrenia and I want to be there for them, but I'm unsure how to react when they're experiencing delusions or hallucination. What's the best way to provide support without overwhelming both of us? It's extremely great that you are thinking about your friend and also wanting to support them when they are having a tough time dealing with a major mental health disorder. A lot of times it is difficult to know that whether I don't really have this perception, I can't really hear what you're saying, or I may not really believe in what you do with so much conviction, then how can I validate that? But it is still possible, as we just mentioned previously as well, to validate someone's experience without letting it be something that we consistently agree with or not. What I mean by that is that you can understand that someone may be having a hallucination, which is a perception that you may not necessarily know about or be able to perceive yourself. And yet, having that space to just validate that I understand this is what is going through for you. I understand that this is what is happening for you when you see this is extremely important to make the other person be heard and let them know that you hear them. You don't necessarily don't believe them. Another aspect is to have some amount of reduction in what we call as certain negative expressed emotions. A lot of times, what we might find is that when someone around us is struggling with schizophrenia, there's a lot of criticism or hostility about how they are reacting or what are their actions, what are their behaviors. And both of these are strong emotions that, when felt consistently over a time, is extremely harmful for even someone struggling with schizophrenia. So, take some time to reduce the amount of criticism and hostility if it comes up for you. Take some time to also do your own research about schizophrenia itself. And the other aspect or the other expressed emotion that you want to take care to reduce as much as possible is to not be as over involved with them. Over involvement essentially means trying to be there for them in every way possible, to the extent that even tasks that they may want to take up by themselves, that they feel that they are empowered enough to take on, which they have no difficulty through their symptoms of psychosis taking up, it makes it something that they feel slowly, little by little, less and less confident taking up if their caregivers are taking them up as much as possible. Even if they may be smaller tasks, we want to somewhere regain that person's sense of self, which doesn't necessarily only stay defined by schizophrenia. Help them to have certain tasks that they may be able to take up, encourage them to take them up, and be as supportive as possible, even if they make some mistakes. My mother has been diagnosed with dementia, and I'm finding it hard to cope with her memory loss. What resources or support systems are available to help families like ours? One of the things that is extremely important to remind yourself of at this point is that your mental health is equally important, and that there may be certain emotions that you may be feeling at these points when you are trying or you witness a loss of memory of something that you would have never imagined that they might lose out on their memory of. But these emotions are not invalid. And to better support your mental health, there are a number of resources like online support groups or even in person physical support groups that can be present in the surroundings around you. It's an extremely difficult time for you as well to be dealing with someone else having a major mental health disorder. It can bring up an exhaustion or fatigue for you as well, and if not addressed at this point, may lead to a stronger sense of burnout for you as well. It may also help to actually go ahead and reach out to a mental health practitioner for some kind of support for yourself as well. It definitely is not at all invalid to want to reach out to a mental health practitioner for therapy yourself. Being a caregiver is a consistent and ongoing task that can take a lot out of you. I would encourage you to take some time to focus on yourself while also putting in the time to support your loved one. My partner has ADHD and finds it difficult to stay organized, which causes tension between us. How can we create routines or systems that help them manage this better without feeling like I'm constantly nagging? One of the things that can be difficult is getting tasks maybe around the house done when ADHD is something in the picture. One of the things that can help is to have an open conversation about what aspects or what tasks can be really helpful for your partner who has ADHD to take up. If, let's say, there is a task that involves some amount of novelty, for example, something like fixing something around the house or having to take on some amount of gardening, doing certain kinds of tasks that don't necessarily have to be monotonous, if these things can be factored in, it may be a great chance for your partner with ADHD to take on tasks that can be better for them and more have a larger probability for them to be consistent with them. Another aspect that could help is to also have this conversation about what may be ways in which they can feel better encouraged to do these. If, let's say, what can help them or keep them better on track is just certain aspects that can have one place where all of the things to do a particular task can be put up. For example, if it is to do laundry, everything that laundry needs or all of the things that pertain to the task of doing laundry can be in one particular place, which doesn't involve many other tasks and distractions from them. It may be easier for your partner to go ahead and take on the task once and then have all of the steps be completed when things are easily accessible to complete the task at once. One of the most important things that we need to remember is that your sense of belief in them completing the task can also be a great source of encouragement to continue to do it. If there's a large amount of skepticism from your end that I don't think you will be able to do this, you've never been able to do it till now, why would you now? That discourages the individual even further to take it on ahead. I live with schizophrenia, and during episodes of paranoia, I find it difficult to trust even my close friends and family. Are there grounding exercises or tools I can use to challenge these thoughts while staying connected to reality? If someone struggles with paranoia as the area or the kind of schizophrenia that they are suffering with, it essentially means that there's a consistent amount of fear for your own safety, which is a big part of what troubles the individual suffering from schizophrenia. While struggling with this, there is an understandable lack of trust on the people around them. One of the things that can really help you to come back to that space of reality when having a tougher time, trusting someone around you to have good intentions towards you, grounding, as you mentioned, can be a really helpful way. Now, what does grounding really mean? Grounding essentially means that while we are having a lot of thoughts, or a lot of worry specifically, or fear, or any of these intense emotions, we might find that we tend to think a lot more about what might happen, about how we may be harmed, what may be the various future consequences. Or we might also reflect into past experiences where we are trying to find cues for when they may have not had the best intentions. Now, here, grounding essentially means to come back to the present moment, to be much more in touch with the here and now. Touch is one of the best ways that you can bring yourself back to here and now without consistently without consistently having too many worries about the past or the future. This could simply look like having a small token that you might know is a message for you to come back to the reality. If there is some place that you can have your hands touch a place around you, it's extremely helpful to also detail in the description of the touch that you can feel. How does this couch feel around you? Is it something with a bounce? How's the texture of it? Is there some way that you might want to describe it? It may also be helpful to use other parts of your skin to also help you to have a lot better idea of where you are right now. Again, do the same with other sensory organs as much as possible as well. If helpful, eat something that can have a stark enough contrast of a taste for yourself to come back to the present moment. It could be something that's extremely sour, which can help highlight the taste which is happening, which is something that you are experiencing right now, which can help you come back to reality as much as possible. One of the things that I would want to say is that schizophrenia is a difficult experience. It's okay to have times when you might find that your relationships are getting affected because of certain symptomology. When you find yourself in a much better place, have a conversation with them and let them know that you do care about them. But whatever may be certain statements or certain behaviors that you might show at other points is not necessarily a reflection of you or your regard for them. My sibling has severe OCD, and their compulsions around cleanliness are taking over their daily routine. How can I help them find a balance between addressing their fears and living a functional, fulfilling life? we can understand that sometimes when OCD takes its form in a very severe format, it can take on a large part of your day being involved continuously in the compulsions that you are taking up. It's extremely important to help them stay regular with their treatment plan. That's the most important way that you can support your loved one who is struggling with OCD. That would include going for their follow up doctor appointments, following consistently up with therapy, and also having a little bit of a conversation with them about how and what is something that is being spoken about. What is it that they are learning when they are going for therapy themselves as well? As specifically for OCD, whatever is happening in the therapeutic setting needs to be applied in their everyday life as well. If your sibling is comfortable with the same, you may ask or want to be involved in the treatment yourself so that you can help and encourage them to practice what is being learned at therapy to also apply it in their everyday life. Now, as this may be something that you can do, also help them with taking their medications at a much more regular pace. Another thing that can be extremely important for you to remember that when we speak about some experience that someone suffering from OCD may be having, you don't always have to agree with what experience they may be having. But it can be possible for you to validate their experience of distress, especially even if you may not think that this is a valid enough fear that you might have, it is distressing for them. And it can be possible to validate their experience without necessarily agreeing or having the same kind of experience. This could sound like, I understand that you are having a lot of difficulty or that you are extremely anxious about this surface not being clean. I realize that the distress is quite difficult for you. And just saying that can also make the other person feel heard and know that you believe in their experience as much as it is important for them to also know how to reduce the compulsions after it. It is extremely important for them to not feel like their experience is being diminished completely. I hope this helps in taking some steps in validating and helping them live a better, more fulfilled life. Good. One of the first things that I would suggest is to take some time to reflect as to what led to increase or what made you feel triggered to have these urges come back. It can be a great idea to take some time to reflect into what were these situations that are leading to feeling triggered to self-harm again. It may also hence cue you to realize what emotions are the ones that are leading to you needing to self-harm. As I mentioned, we often use self-harm as a way to cope with some of these triggers. What I mean by that is sometimes there may be a multiple number of reasons why self-harm is used to cope. It can provide as a way for you to come up from certain numbness that you may be feeling. Sometimes the emotional pain that we may be feeling may be a bit too much, and at that point, physical pain can act as a helpful distraction or something that you may be able to better manage if feeling like the emotional pain is too much to deal with. And hence, recognizing or trying to understand what these emotions are that are making these feelings come up for you is extremely important to become a little bit more aware of. If reaching out to a mental health practitioner is possible, I would highly recommend that you do the same, as that can provide a safe, non judgmental space for you to talk about these urges and to talk about and understand these emotions a little bit better so that you may be better equipped to deal with the coping skills apart from self harm to deal with them. Some of these coping mechanisms could look like having to take a little bit of a pause before the urge comes up and actually taking the action itself. That may be in the form of just going ahead and splashing your face with some amount of cold water or just letting cold water run on your hands. Again, The temperature shift is a stark reminder of your present surroundings for you and can provide as a helpful reminder of the present situations around you, apart from where your mind has been taking you when you've been experiencing a very highly intense, difficult emotion. Now, if this distress is too much, it may be helpful to have that sensation be there and use some form of coping mechanism or regulation techniques that you may have either learned in therapy or to take them up now. Some of it could look like taking some time down to journal. Journaling is a great way to become a lot more aware of what these emotions are, where they are coming from, and what are certain needs that need to be met, which, if not being met, are leading to these difficult emotions. Having that space to reflect on this can help you to reduce the reliance on self harm as the only coping technique that you may have. It may also be helpful to include in some physical movement once in a while. Physical movement can provide a great expression or a channelized space for you to express the emotion that is coming up without necessarily letting it be something that's in a way harmful for yourself. I hope that some of these techniques, like reaching out to a mental health practitioner to learn a little bit more about yourself and different ways to cope with your emotions, as well as to use journaling as well as a way to somewhere include physical movement into your daily routine to help channelize the difficult emotions that may be the precipitating factors or triggers for what you may be experiencing right now. My partner has been self harming as a way to deal with their trauma, and I feel helpless. How can I support their healing without feeling like I need to fix them or their situation? Self harm, often, if seen in lieu of certain traumatic events that may have happened in a person's past, can be a way to again cope with certain difficult emotions. As a partner, I can understand that this may be extremely difficult for you to experience as well, especially because the reasons why your partner may be using self harm as a way to cope is not completely related or something that you may have a control in any ways emphasizing or taking some control of. One of the things that I'd like to stress is that when someone is taking some time to work through the traumatic events that they have experienced, they may have a lot of difficulties or strong emotions that may come up. Having the support of a mental health practitioner at this point is extremely important. Encourage them to reach out to probably a therapist, a psychologist, who may be able to guide them better into what may be these various ways that they can channelize these emotions without necessarily relying on self harm. Now, apart from this, how you have been feeling can be a lot of helplessness, as you mentioned, and that sense of sometimes also feeling like you need to fix them or that you need to be the one who can rescue them or support them. One of the largest parts of being a caregiver is sometimes to feel completely responsible for your loved one's care and health completely. But something that I'd like to mention is that someone who has been dealing with their traumatic life events is also, in a large part, capable of managing their own emotions. Yes, they may have hiccups. Yes, it would be difficult. But you need to also believe in them to have the encouraged space to work on themselves with your support. It's not always your job to fix something for them, but to encourage them to look into what may be difficult for them and to have your support as someone who can be there to, without judgment and without necessarily a space of criticism, understand them and provide them with the safe space that they need to work on themselves. You don't need to facilitate change for them, but rather be there while they work on modifying certain aspects, certain responses that may be difficult for them to deal with. For yourself, I would encourage you to also seek out some kind of support for yourself. Even if that looks like maybe joining a support group or having someone whom you can also share what is difficult for you with. if that looks to be in the form of someone that you feel you can trust. But also take care to also protect the privacy of your partner in doing so. It can be possible that you might want to have a conversation with them into what may be the best source that they feel okay you talking about this too. If it's better for you to also reach out to a mental health practitioner and seek some space where you can get a space to talk about what's difficult for you, it's most important that you reach out as well. As I mentioned, you may have a tough time somewhere letting go of that responsibility. But healing is not something that another individual can necessarily facilitate, especially when there are difficult experiences that someone has had. They are the one who can most often have some of the other changes that they can start to make with your encouragement, with you providing that safe and secure space where they can come back to, even if the change that they made may not have been most helpful or easy for them to take. It may be best possible to act as that support system for them. Imagine like they are the one who are learning to drive and you are in the passenger seat trying to give imagine that they are learning how to drive and you are in the passenger seat guiding them and supporting them in whatever way possible, but not necessarily taking the steering wheel away from them. I hope this can be something that, as you may want to take a couple of steps towards this, it may be helpful to put this into action, to know that they can and they have the potential to be able to help themselves with your support and encouragement and the safety that you can provide. I hope that this may be most helpful for you. Thank you.